All right, I think we'll go ahead and get started. Well, welcome everyone. I'm Steve Baldwin again with the Los Angeles County Department of Public Health, and we are absolutely honored to be partnering tonight with the American Academy of Pediatrics, Chapter 2, and our close partner, First 5 Los Angeles, to offer tonight's town hall on a resource that we feel will be a great benefit to you and to the families you support and serve, and that is Help Me Grow LA. We have a fantastic lineup of presenters tonight, including Dr. Priya Batra, the medical director from the Health Promotion Bureau here in the Los Angeles County Department of Public Health, Lisa Scheuer, who is a member of Help Me Grow LA's Community and Family Engagement Council, and finally, Laura Stein, who is a program specialist here in the Los Angeles County Department of Public Health with Help Me Grow LA. The agenda for tonight includes an overview of the Department of Public Health's commitment to strengthening early identification and intervention in Los Angeles County. We're going to provide an insider's look at the parents' perspective on working with physicians and healthcare providers on child development issues. We'll provide an introduction to Help Me Grow LA, including how to refer your patients and how to access resources Help Me Grow LA has to offer. All of that, and we'll still have time built in for questions around the midpoint and hopefully for about 10 minutes at the end of the evening. So before we start though, we have a question to get you in the right frame of mind for tonight. So in just a moment, you'll see a poll question window pop up on your screen. And so go ahead and select your response. I'll read the question and we'll give you about 15 seconds to complete the poll question once it starts. So the first question tonight is, during well child visits, do you screen for developmental delays with a validated screening tool? The answer is A, rarely, about 20%, B, sometimes, up to about 40% of the time, C, often, about 80%, or D, always, 100% of the time. So we'll give you a few seconds to respond. So it looks like about a third of you have responded. So with 29% participation, well, there's a few more trickling in. Thank you. So the highest number of responses so far is 100%. So about half of respondents are saying that they screen with a validated tool always. And about a quarter of you are saying often. Some are saying rarely or sometimes. So, and that's great. Appreciate your honesty there, and hopefully we'll all move forward together in this process of really understanding what developmental screening is and how to overcome some of the barriers that some of you might be feeling around implementing developmental screening in your workspace. So tonight, I'm really excited to introduce our first speaker, and that is Dr. Priya Batra, who is my colleague in the Department of Public Health. She is the medical director for the Health Promotion Bureau in our department, having joined our team earlier this year in 2022. Dr. Batra is a board-certified obstetrician gynecologist, having completed her medical degree at Columbia University and her clinical training here at UCLA. She also earned a master's degree in health policy and management at UCLA's Fielding School of Public Health. And Dr. Batra's formal training and experience in health services research and implementation science play a large role in her approach to improving health and equity across communities. With that, I'll welcome to the virtual podium, Dr. Priya Batra.
Good evening, and thank you so much for that introduction, Steve, and for letting me kick off this evening's event. It's a real pleasure to be here with this team and with all of you to talk about child development and Help Me Grow LA. And this is a program that I really believe can help children and families in your care. So in public health, we really aim to focus on primary prevention as much as we can, focusing on those upstream approaches to catch issues early before they become bigger, more complicated challenges. And I really think that screening children for developmental delays is the perfect example of an upstream approach to preventing a more serious downstream set of challenges later in life. And this is why our familiar AAP Bright Futures periodicity schedule recommends developmental screenings at 9, 18, and again at 24 or 30 months with a validated tool like the Ages and Stages questionnaire. And some of you may have practice requirements to screen at particular cadences or to use a particular tool, a different tool. But whatever the cadence or tool is, you probably already have access to them. That said, beyond just having access to the tools and the schedule, there are numerous challenges to screening that pediatric and family medicine providers face. For example, lack of time during an office visit, competing priorities and or the patient and family's needs, or simple things like workflow issues. You may not have a standardized approach in your office to handle developmental screening and the referrals that come from screening. And these are just a few issues you may face. And another barrier that many providers report is really being unsure what step to take should the screening show that follow-up or referral is required. And this idea of what do I do next, right? If the screening is positive, is not limited to screening for developmental delays. As an example, you may have seen the US Preventative Services Task Force recent recommendation that all adults under age 65 undergo screening for anxiety. Now, a group of my colleagues and I were texting about it, and the consensus was it's a great idea, but still we were apprehensive about implementation as a new screening because of the challenges related to this what next question. So ironically, thinking about what to do about anxiety screening was causing all this anxiety, right? And so I think that Help Me Grow LA is really positioned to help remove that what do I do next barrier from your thinking when it's time to screen a child for developmental concerns. You can simply refer the family to Help Me Grow LA by giving them the phone number or website, which we'll share at the end of this presentation, where you or they can submit a form that's received by a Help Me Grow LA resource liaison. So this team, the Help Me Grow team, will then call the patient back at the day and time indicated on the form to close that loop. So you don't really need to worry about what to do next or what referral to give. The Help Me Grow LA staff will just take it from there. They'll provide connections to the appropriate service, whether that's a regional center, a family resource center, a school-based program, et cetera. So they'll really figure out the correct set of next steps based on the age and the needs of the child and family. And so this is just one way in which we hope that Help Me Grow LA can support your developmental screening workflow. It's really designed to be dynamic and flexible to respond to whatever challenges you may be facing in this area. And we really think this service will be great for all kids, particularly for children of color who tend to receive services for child development later in life. A study from last year out of UCLA showed that children of color have lower rates of access to both screening and early intervention services compared to white children. And there are enormous implications to this in terms of health equity, because with developmental issues, as we spoke about, these concerns become much more significant if left untreated. And these long-term effects can affect schooling, relationships, family life, earning potential, the list really goes on and on. And so we know that these developmental issues, gaps in screening and treatment are really emphasized for racial and ethnic groups or folks with low income levels because they tend to be unjustly burdened in so many other ways from a health perspective. So really implementing developmental screening universally is a solution to a big societal problem. Early screening and supporting families with information and links to resources, a small intervention, along with support when needed, really pays dividends down the line. And so Help Me Grow LA, again, is positioned to help all of us make some inroads in supporting the families that have children with or at risk for developmental concerns, as arguably these are the families that really need our support the most. So as we hear from tonight's speakers and learn about Help Me Grow LA, I really encourage us all to think critically about how our practices impact families and what we as a collective can do better to support pediatric care for the families that we serve. And I want to encourage you to also directly engage in our dialogue tonight and take back what you discovered today, and use the tools that Help Me Grow LA has provided to improve the systems that we're all working in. So we also really want to recognize this evening the value in an organization like AAP supporting Help Me Grow LA and its mission to expand access to developmental screening and early intervention. So finally, thank you for being here tonight. I'm happy to connect afterwards if you'd like to talk more or have more questions or need resources from the Department of Public Health. And so I'll ask our host to share my email address in the chat. And with that, I'll pass it back to Steve to continue with the rest of the program. Again, thank you very much for joining us.
Thank you so much, Dr. Batra, for that and for your ongoing support and commitment to this work. So much appreciated. Our next speaker, I'm really thrilled to have her here tonight. She's a dear friend of this work and of our department and really everything that we do in Help Me Grow. And I'm going to share my screen. Here we go. All right, I think I've got it. Lisa Scheuer is a parent and member of Help Me Grow LA's Community and Family Engagement Council, which is charged to keep family at the center of all that we do in Help Me Grow LA. Lisa has a Master of Fine Arts degree from CalArts and spent 7 years as an adjunct professor in studio art. She's now a fellow of the LEND program. LEND is Leadership Education in Neurodevelopmental and Related Disabilities at the USC University Center of Excellence in Developmental Disabilities. And she's a founding president of the Racipathies Network. She's a mom of Turner Johnson and her older brother, Quinn, who had Costello syndrome. Quinn's care was supported by a Medicaid home and community-based services nursing facility AB waiver, which opened the door to General California Children's Services Program, also known as CCS, in addition to their financial eligibility free medical therapy program. Quinn also received special education services through orthopedic low incidence category and was also a regional center client, receiving both Early Start and Lanterman Act services. After Quinn's death, Lisa was chief of family support at CCS for 6 years before transferring to the Department of Mental Health, where she currently is the countywide regional center liaison coordinator and liaisons for children age 0 through school age. So without further ado, please welcome again our dear friend, Lisa Scheuer.
Thank you so much, Steve, for a very warm introduction. I'm really thrilled to be here on behalf of the CFAC, as we call it. It's much shorter to say that. Who would like to share that we really appreciate how family representation has been engaged meaningfully from the very start of this project. For this meeting, our council thought we'd develop a tip sheet, recognizing that this room includes pediatrician champions, as we can see already from the response to the first question. So, a la Atul Gawande's checklist manifesto, we will move forward after this. The list of current members here, we have 7 of us in the green box, and we are adding 8 more in October, so we're really quite excited, filling in both regional and cultural gaps that the first round didn't have as much time to put together to start the whole project going. So we're very excited on the next steps.
Lisa, sorry, we're not on the right slide.
Oh, okay. Sorry, next slide.
There we go.
Thank you. Sorry, so here's the list. And so we have 7 of us, and those are the 7 there. And then we're going to be expanding to add 8 more. And the importance of this is to have families and children at the heart of the Help Me Grow LA efforts. All right, next slide, please. There we go. Sorry. So here's here I am with my family, with Quinn starting his cancer therapy, and we really felt that the key that we wanted to help pediatricians remember is the importance of conversations with families. If it's done well, we leave feeling comforted, more informed, and empowered, and motivated to take the next steps in our child's care. And if it's done poorly, as I think we have too many stories of parents being told your child won't walk, your child won't talk, and, or even this child is not conducive to life, all these things that really stab us in the heart. And then our children live longer than anyone ever expected. And that just leaves that feeling of discouragement at the time, ignored, not sure what to do next. And then it actually builds distrust. So really, here are our tips to help strengthen the conversation. Next slide, please. So the first one is to listen to our concerns. We are closest to our child's daily behavior, and it's hard for us to share concerns. I was reminded in a listening to a blog on Cambodians providing mental health services for Cambodians, where the interviewee was saying, I had been told that when I asked my clients about, why they came to me, they would say, "You're the doctor, you're supposed to know." And that really resonated with my childhood, where it was like a real test to have the doctor know all the things, like, by the way, does your elbow itch? Or something like that, that indicated, oh, you know more than I do about me. So really helping the family be more confident in knowing what to look for and share really helps. And it's that equity consideration also for the population not typically considered in the process of being partners, to feel listened to and involved in the decision making. Okay, next slide, please. So tip number 2 is to support understanding. Check for understanding by rephrasing if needed, asking the parent, us to reply, see what we understood. I know that I listen to a lot of stuff and I think I understand, I'm nodding, and and I'll even be asked, did you get that? And I'll say, yeah, I understand that. And then I go home to tell my husband and it's like, I can't explain it. So to have me repeat or rephrase what you tell me it really helps me then prepare to talk to my husband about what went on in the meeting. Provide the key information in writing, the diagnoses, the recommendations, so we can absorb it at our own pace. And if we don't understand the words, then we can still have time asynchronously to look it up or ask somebody to help us dig deeper and understand it. So all this information is new and complex. It's a whole new language, whether or not we have a master's in fine arts, or if it's a second language for us, or it's a third language, actually. If you think about indigenous people from South America who are assumed to be speaking Spanish as their first language. So, but we are able to learn, and as we move through the process, we do learn things like subaortic resection of the left ventricular septum and stuff like that. So we are teachable, we love our children, and we want to be able to care for them. Next slide, please. So the third tip is to offer hope and next steps. Please focus on what we can do and not what our child can't do. Going back to that, your child would never walk and all that other stuff, that's really scary for us. And so instead, help us understand how development works. It is a scaffolding process. So, if we can help your child learn to sit, then your child can learn to roll over. And, so all these things, instead of what our child can't do, give us those milestones and smaller pieces, what we can look for. So each one of those is big for us. I still remember a friend encouraging me to have a second child because, raising a neurotypical child is like, you don't have to teach them to walk. They just do it on their own. Who knew? So really, anything to help us look for clues, positive clues, is really helpful. That way we are involved in supporting our child's development and we know how to engage more effectively. Next slide, please. So please acknowledge the child in the room, and particularly for us parents who are so absorbed in trying to take care of the problems our child has, going to all the different places, focusing on approaching the person providing the service as deeply as we can with respect to their service, we do lose sight of our whole child in that room. So if you can help us by talking to the child directly, not only does that help us with remember our whole child, with that you see our child as a whole child, it also helps us understand, because if you bring the language understanding to the child, who probably does understand more than we realize, it also helps us absorb the information at a more linguistically, I won't say lower, but more approachable level. So if you help us, if you help them, you help us in the process, and that really makes a huge difference again in the provision of and integration of partnership. Next slide. So yes, we have ideals about translation. We recognize that getting a translator in time is a real challenge. If you can do it in advance so that at the time of the appointment everything is in place, that's ideal. We recognize there's a shortage of people, so best practice. Know your limits if you don't speak another language fluently, and do try, if possible, to translate written recommendations. I still remember a story where a doctor was saying how he almost made a humongous mistake. He was telling a dad, monolingual Spanish, to take these pills, to give this, this prescription, one pill once a day, or this pill once a day, right? And the dad is Spanish speaking, so he said once a day, right? Once a day. And the father's like perplexed, and he says once, and the doctor said sí, once. And he put his finger up for one, but that can also be like a declarative sign, right? Rather than just one pill or once a day. So then it was brought to his attention that once means 11. So the dad could have overdosed his child if he had gone home with the doctor saying, sí, once. So please, please try when you can to be as careful as you can about translations. Next slide, please. It's okay to admit that you don't know. Being honest is really how we build trust. And I learned from an incredible advocate for her son that she actually chose her doctors by those who were willing to say they didn't know. And I went ahead and borrowed them, and they were fantastic. They knew what they knew, but they couldn't know the complexity of my child, and they needed my help to investigate. And so I trusted them more because I knew that I had more trust. I already said that, because they were admitting that they needed my help, and then I was able to provide that, and that really built more strength in our relationship. I am now a total maven on Costello syndrome and many of the restopathy syndromes because of the things that I've had to read for my son to advocate for him. So please be confident that we know that you know the skills you've learned, and that we want to share again what you don't know. Okay, next slide. So if it seems overwhelming for you in terms of what we parents are looking for, translations, understanding what's going on, how to better speak with you in terms of communication and all that stuff, you are not alone in those 15 minutes that you have to come up with ideas. You can refer to parent support. In California, we have the Family Resource Centers Network that is published on the Developmental Disabilities website, our State Developmental Disability Services website. And so that's fantastic. The roster is there. these are parents who have been trained to provide parent-to-parent support, so there's quality involved here. And they can help also because they have families from different cultures and backgrounds and different languages. So you don't have to be the end-all answer. You can actually help them reach out to these people who can also help with other things besides medical issues. So that please consider that. And, you know, a way to find the local family resource center for that family is to go to the Help Me Grow Los Angeles website. So next slide. And if you're not sure where to start, there it is with the helpmegrow.org, because service eligibility criteria are complicated and can change over time. And navigating services takes not only knowledge, but time and persistence and advocacy. So you don't have to be the know-it-all. You can be the person who knows where to go. And so the next slide is a checklist, and we'll be working on a handout, hoping that will help you, and maybe you can share it with others to help them help other families. And so now with all of that, thank you. I have to thank the members of the Community and Family Engagement Council for helping me put this together, and I will hand the mic back to Steve.
Lisa, thank you so much for that and for sharing and being so generous with your time and energy and expertise. We so value your partnership in this. All right, so let's go ahead and move into the next segment of our presentation. And before we actually proceed with our next speaker, we have another question for you. All right, so question number 2. Here we go. Okay, once a developmental concern has been identified in your office, how confident do you feel knowing where to refer families for services? And again, you're going to see a window pop up. So A is not confident. B is confident with some diagnoses. C, confident with most diagnoses. And D, very confident. I'll give you a few seconds to think about your answer and submit. Oh, we're getting more responses this time around. That's great. So coming up on almost half of meeting participants responding. So got about 45%. Well, oh, yep, we hit 50% of meeting participants responding. That's great. All right, so with 50% of respondents in, which I imagine that is represents the medical providers in the room, 43% are very confident, 20% or 19% are confident with most. I think I can share this. Oh, it's been shared, great. 33% are confident with some, and a few of you, well, one of you, 5% is not confident. Well, and that's okay, because I think we're about to, well, I don't think, we are about to share a resource that is going to help you feel more confident in knowing where to refer families that need additional supports around their child's development. And to do that, I'd like to welcome my colleague in the Department of Public Health, Laura Stein, to the virtual podium. Laura is a program specialist with the Help Me Grow team here in the Department of Public Health. She's the lead on partnership engagement and community outreach for the Help Me Grow LA team. Before joining Help Me Grow LA, Laura worked at Dignity Health Northridge Hospital and led a 12-agency multidisciplinary team combating elder abuse and a 6-agency workforce providing COVID-19 vaccine and resources throughout the county. Laura earned her master's in public health, specializing in healthcare administration from National University, and her work in public health, community building, resource development, and education is reflective of her passion and truly her incredible work ethic. It's really a pleasure to work every day alongside her. And so I'd like to welcome Laura to the podium. Laura?
Hi, Steve. Thank you so much for the kind intro, and welcome everybody. I'm going to go ahead and get started by sharing that by the end of this presentation, this portion, you're going to be able to identify and describe what we call the centralized access point, CAP for short. You're going to know how to access and refer families to our CAP, and you're going to know when and how to use Help Me Grow LA. I'll start out and share some basic information about Help Me Grow and the Help Me Grow model. Help Me Grow is a national model. It started in 1997 with a focus on promoting early identification and intervention of developmental delays. There are now Help Me Grow systems in nearly every state throughout our nation, and California is somewhat unique since we're so large. 48 out of the 58 counties are currently operating or in the planning process of operating local Help Me Grow systems. Help Me Grow LA, as you have heard earlier, is a collaboration between First 5 LA and the Los Angeles County Department of Public Health. And our focus is on young children ages 0 to 5, but we help all families. We officially launched our centralized access point in May of this year, and we help families and providers find early support when there's a concern for developmental delays or missed milestones. We serve all folks in LA County, and there's never any income eligibility. All right, so as I mentioned, our centralized access point is called CAP for short, and it's a key component of the Help Me Grow model, and every Help Me Grow has one. It's a technical term that describes the ways to connect with Help Me Grow LA and the ways and find ways to find and use what we have to offer. Our centralized access point is truly a call center that's staffed by our resource liaison team and also our website. And here you'll see pictures of our resource liaison team. And next to that, you'll see a picture of our website homepage. And this training that I'm delivering is going to just give you details about both of these components. So we built Help Me Grow LA around what we anticipated would be the different levels of need of our community, with different services based on the need of the user. And the levels of service begin with the self-serve level and progress as far as a deep dive with families providing resource navigation. Let's go ahead and start with our call center. As I mentioned, it's staffed by our team of resource liaisons. Sometimes we refer to them as RLs for short. They provide resource navigation. Everyone on the RL team has a background in child development and experience navigating the systems of care for children with special needs. And you'll see our call center phone number and our hours, and we are extending our hours in the near future. So on this next slide, I want to give you an example of what happens when you call our call center. So when a parent or a caregiver calls our call center, the RL is going to determine that they need either in-depth assistance, and they'll have a conversation and ask a set of questions to figure out the best referrals. We call them connections. And the call has a general format, and the RL starts by collecting information, finding out what the parent's concern is, what the age of the child is, finding out if there's a screening done, if they're currently receiving services, if they have a regular physician. And the RL uses all of this information to determine which referral pathway to follow with this family, or which agencies to connect them to. And I'm going to go into a little bit more detail in the next slide about that. The RL then provides resources to the family based on this conversation. And again, I'm going to go into more detail on the types of resources we offer. So then our resource liaison continues the call by summarizing everything, the connections and resources provided, and ensure that the parent knows what to do next. Because remember what Lisa had said, you know, you're giving a lot of information. We want to make sure that that parent is able to know what to do next. And finally, we're going to summarize all of this information in writing, whether it's email or even if we have to mail a hard copy, we will go ahead and make sure that the family has all of this information in writing so they can digest it in their own time. The resource liaison team is also going to follow up with our families in about 3 weeks after the call to see how things are going with that referral or set of referrals. And they're going to find out if the family was able to connect, for example, with the regional center. And if the connections didn't work out, our team is going to continue working with the family to either address those barriers or make different connections. And we really take a holistic approach and work with each family as individuals. All right, so it is a pop quiz time. And in a minute, you're gonna see another poll pop up on your screen, and I'll go ahead and just read the question. So what is the eligibility criteria for early intervention services for an infant or a toddler? Is it a 10% delay, a 25% delay, a 33% delay, or a 66% delay? Oh, we're already getting answers. Wow, this one's fast. We're already up to almost 40%. And I see a lot of folks responding, and currently out of our responses being received, 55% of those responses are saying a 25% delay. All right, it looks like we've now just reached 50% participated in the poll. All right, and all right, so you can see here our poll responses. The majority of you selected 25% delay. Fantastic. Well, I'm really pleased to hear that. And so we'll go into a little bit more about this answer of being a 25% delay on this next slide. So recently, as you can see here, June 30th, the California Department of Developmental Services, referred to as DDS, changed the eligibility criteria for regional center early start services from 33% developmental delay down to 25% delay, which means that more children are now eligible for early start services, and that's children specifically in the 0 to 3 age category. So in addition to that, some other changes that took effect is that the communication development has been separated into 2 categories, which are now expressive and receptive communication categories. And one of the last changes that I do want to highlight is, as we know, fetal alcohol syndrome, it's now been elevated as a serious risk factor for developmental delay. And I think in the chat, you'll see that we've dropped a document that covers all of the changes. Thank you. All right. So now that we've covered the changes for the early start services, we'd like to share some details about our general navigation workflows, which you'll see here on the chart. And again, this is referrals based on age. So when a resource liaison is speaking with a family, the connections and referrals that they offer depend on the age of the child and the family's concern. In the interest of time, I'm not going to read all of the details, but you can see that we address concerns related to development, including mental health and behavior. And our main connections are regional centers, school districts, and mental health agencies. All right, next slide, please. Perfect. All right, so we also share some excellent resources with families, like what you'll find on our helpmegrowla.org website. We have the CDC milestone checklists, links to milestone trackers and child development websites, information about lead screening, and a lot more. These are all great resources that you can share with families as well. And our goal is really to boost the backgrounds, the family's background knowledge about milestone screenings, child development, and what they can do to help their child. And all of these tools are on our website and are downloadable. So speaking of our website, we're going to go ahead and take a tour. So I'll give Steve just a minute to pull up our website. As you can see, here is our home page. And I'm just going to highlight our website across the top, and you'll see it's broken into categories. So we have the family and caregivers. We have a provider section. We have a section for partners, a section for resources, a way to connect with us, which I'll go into some detail about that, some information about us. And then with one click, you can have our entire website translated into Spanish. So I'm gonna highlight some sections, and we're gonna scroll over to our family and caregivers and use that drop down to go to our programs and supports. And I'll give it a minute. So if you scroll down, you'll see we have information about our regional centers, both Early Start and Lantern and Act services. And we also have links to a regional center locator and links to each regional center. Steve, if you could scroll back up to the top of this page, and let's take a look at that provider tab. So we have information for providers, and I'm going to highlight a few. So Steve's already scrolling down, and here you'll see our downloadable PDF called Screen, Score, Act. And this is a workflow for implementing developmental screenings using the ASQ and the MCHAT. And if you continue scrolling down, you'll find a link to our regional center referral guide for providers. This guide provides excellent information about how to refer a family to the regional center. Just below that guide, you'll see a link to First 5 LA's Provider Toolkit. And this is a toolkit, which is a guide for implementing developmental screenings in the pediatric medical setting. It has tip sheets. Well, as you can see, as Steve is scrolling, it's a comprehensive guide, and I encourage you to download it and share it. All right. So if you scroll down, you could also see we've got tip sheets for talking with parents about developmental concerns. and other resources as you scroll down. And all of these resources, or many of them, are going to be provided in a follow-up email that we'll send out on Monday. All right, so let's scroll back up to the top and let's look at our resource section. And if you hover over the resources and scroll down to the early start tools. All right, so here, if you scroll down a bit, you're going to find links to milestone apps and milestone checklists in both English and Spanish. I'll give Steve a minute. There we go. So you could see these are the CDC checklists, milestone checklists that are all available as downloadable tools. You'll see we have resources for dads and more. And we've got tip sheets for parents on how to talk to you about developmental concerns. So a bunch of great resources. And then even further down, we've got a link for the free Easter Seals online ASQ that you can share with families. So let's go ahead and scroll back up and look at our main menu and go to the Connect page. And this is what I'm really excited to share. So when you scroll down on this page, you're going to find help forms. These help forms are broken into sections for family and caregivers. And below that, there is a second help form for providers. So let's talk a little bit about that first help form for families and caregivers. If you want to refer a family to Help Me Grow LA team, this is one way to do it. You can simply help the family fill out this information on the form, and you can check off all the areas of concern, which are on the right side, and then just hit the submit button. The form comes directly to an email box that's monitored by our resource liaison team. And on this form, as you can see, you can identify the best day and best time for us to reach out to the family, and we are going to do our best to accommodate that. So if one more point I want to ensure on this, if you are referring, if you, the provider, are referring a family using this form, please make sure to let your family know that you're doing this so that they're not surprised when they receive a call from us. So now I want to switch down to that provider help form. If you're a provider who wants to speak with a resource liaison about additional resources for your practice, you'll fill out this form here, the provider help form. And again, just fill in the information. You'll hit the submit button and it gets sent to a box that our resource liaison team monitors. The last stop on this page that I want to take you to, it's at the very bottom. And here you'll find out how to subscribe to our listserv, which is just one of the ways that you can stay connected to Help Me Grow LA. And we periodically send out important information and share available resources that are available throughout all of Los Angeles County. And it's very simple. You fill in your email address and you hit submit. And that's as simple as that. And if you ever need to opt out for any reason, there's a simple way to do that as well. All right, so the last stop on our tour that I want to show you again, as I mentioned, is how to translate our page into Spanish. And we are working and hoping that in the future, we'll be able to have other threshold languages available for our website. So that ends our website tour, and we'll go back to our slide presentation for some final points. As I mentioned, making a referral to Help Me Grow can be done by using our online help form. But there's a second way to do it. You can just have the family call our call center line, which you'll see here. And that may be one of the easiest ways, is just to have the family call our call center. And just, again, remember to make sure that you're letting your families know, if you're the one is the provider making a referral for the family to Help Me Grow LA, that you let them know you've done so, so that the family is aware, and when we call them, they'll know who we are. All right. So next slide, here's just as Steve had showed you on the tour, that same page of how to subscribe to our email list. And we have some final follow-up steps for you to take away with Help Me Grow LA. Call us and speak with a resource liaison. Download our resources from our website. If you are looking to receive a Help Me Grow LA training, we can provide that for your team. Just again, there will be ways to contact us, and then join our listserv. So thanks everybody for your time. We're so excited to have you here, and I'm going to pass the mic back to Steve for the next segment.
Great job, Laura. Thank you so much for that. All right, well, we've come to the last portion of our evening together, and that is time for questions and hopefully some good answers to your questions. So we have about 5 minutes. And so I'd like to just invite anyone who has a question to raise their hand. And I'm wondering, I noticed the spotlight is on, so whoever's speaking is sort of spotlit, and so that makes it a little bit hard for me to see if someone has their hand up.
Steve, we do have a couple of questions in the chat.
Great.
One is, who can we contact to confirm that a mental health agency is on the Help Me Grow LA list?
Thank you for that question. So Laura, do you want to take that one?
Sorry, trouble finding the mute button. Yes, we will provide our Help Me Grow LA email address, and we will be monitoring that. All questions can be directed to helpmegrow@ph.lacounty.gov, and we'll make sure that's dropped into the chat. So you can direct questions there, and we'll make sure that a response is given.
Thank
There
you.
was also some chat going on about DDS's website. It has not been completely updated with the recent changes, but did put in a PDF that does highlight the recent early start eligibility changes.
Great, thank you. And I noticed you sent a link for that. And thank you so much for doing that.
Also, I'd like to mention that on our website, that referral guide has updated information about the eligibility changes. So that's another way to access some information on that.
So just to be clear about the question about the mental health service provider, if you'd like to email the name of that service provider, the location, whatever you want to send us, you can drop us a line again at helpmegrowla@ph.lacounty.gov, and we can check against our database and then follow up with any questions we have for you. Okay, other questions?
Pointing out that the slides were just uploaded into the chat, and perhaps that's something we could send out in the follow-up email as well.
Great. Yes, thank you. Actually, Laura, would you mind, since we just have about a minute left until 7, I know we're going to be sending out an email with some resources attached, including a link to the video, the YouTube video for this presentation. There will be some other resources attached to that email. So maybe if you could just share what folks can expect to receive on Monday.
Absolutely. So on Monday, in addition to what's already been dropped in the chat, I'll be sending out some general flyers that will be in English and Spanish that you could share with families. It's our Help Me Grow LA flyer, and it's a great flyer to help when you're referring a family, to give them as a resource, our flyer. In addition to that, I'll also provide a flyer on our training and how to request a training for your team. So those, in addition to the slides, the links, those will be the additional documents that will be provided on Monday to you.
Great, thank you, Laura. Well, I'd like to just end by thanking everyone for attending and for your commitment and attention to this work. Thank you very much to the speakers and to all who were involved in putting this together. Thank you to the American Academy of Pediatrics Chapter 2, your wonderful partner, and to, of course, our amazing partners at First 5 Los Angeles. Thank you so much for your tireless efforts in assembling this and in everything we do together every day of the week. Very much appreciated. Thank you all. Have a wonderful evening, and hope to see you again soon. Thank you so much. Good night.